All right, welcome back, folks. And in this video, we are going to be covering Chapter 13 of the Rathus Introductory Psychology textbook. This is the follow-up to Chapter 12. Chapter 12, we looked at diagnosing and understanding different psychological disorders. When I mean diagnose, I mean understanding how trained medical professionals make those diagnoses. I don't mean make your own diagnosis, but what are the symptoms, what are the symptomologies of various mental illnesses, and now we're going to look at how we treat those, the different methods of therapy. So by the end of this chapter, you should have a pretty good idea about what psychotherapy is, including various approaches to psychotherapy like psychoanalysis, humanistic therapy, behavioral, cognitive therapy, as well as what the differences between group versus individualized therapy, the advantages and disadvantages of both. We'll talk about why therapy works when it does work, and we'll also then look at biological therapy, which will include, surgery, medications, and other procedures. So broadly speaking, when we talk about treatment of disorders, we're looking at psychotherapy and biological therapy. We're looking at two different methods, and oftentimes the most effective treatment is using both, is using a psychotherapy of some sort combined with medication, some sort of biological therapy. Okay, before we move on, let's talk about schizophrenia, make sure we're on the same page, make sure we understand what's going on. I want you to come up with a positive and a negative symptom of schizophrenia, and so I'll give you a hint. That doesn't mean good or bad, so go ahead and pause the video, write down a symptom or two, or as many as you can think of that would either be positive or negative, or both, Come back when you feel like you've got some answers. Okay, welcome back. Your positive symptoms, these are going to be something that somebody has in addition to normal behaviors. They have abnormal behaviors or thought processes that are different, in addition to something that somebody who doesn't have schizophrenia. Negative symptoms would be they're missing something that somebody with schizophrenia would have, and that typically refers to the way they think, the way they express emotions. So positive symptoms could be hallucinations and delusions. A negative symptom could be flat affect or inappropriate emotional, expressions, things like that, or movement. Physical movement is also something that could be dramatically affected in a negative way for people with schizophrenia. Okay, these are the truth or fiction items we'll be taking a look at for this chapter. Go ahead and maybe pause the video if you'd like and jot down which ones you think are true, which ones you think are false, and we'll kind of move forward as we move along. Okay, welcome back. All right, so we're talking about psychotherapy. Another way of thinking about this is talking therapy. This is where you go to see a therapist. You are the client. You seek out a therapist for some sort of help, and maybe it's a mental health concern, maybe it's a life transition, maybe it's couples therapy. Psychotherapy comes in all kinds of shapes and sizes, and you don't necessarily have to be mentally ill to seek out psychotherapy. In fact, it's healthy for people to see a therapist or a counselor even when they are, just feeling fine. You don't have to always be depressed or sad or upset or whatever. It can be, in fact, very healthy for anybody. But the idea is to look at and get into the thoughts and feelings and the behaviors of the client, and oftentimes modify those. Typically, that's where, why people are coming to a therapist is something's going on with their thoughts, their feelings, and subsequently their behavior. And the idea is to kind of get all of that in line and modify it for the better. Also, it also is common to see people who are dealing with psychological disorders like depression, bipolar disorder, any of the personality disorders we talked about in the previous chapter. Oftentimes, you see psychotherapy is very broad. It can be used for many things. Treatment of mental health, treatment of life transitions, etc., for personal growth, all kinds of things. In fact, now we even see the delivery of mental health treatment, especially in therapy, can be delivered without being even in the same room. In fact, you can have therapy from an app or from a FaceTime-like experience on your tablet or your smartphone or whatever. So it's pretty cool. We're seeing this idea of psychotherapy is very flexible and very malleable. In fact, we're even seeing, as technology grows, this picture is probably somewhat outdated. This is probably the technology, by now it probably, looks a lot different than this even, but using virtual reality therapy to treat phobias, for example, is an example of kind of the future directions that therapy is going into. Well, if you're too afraid to hold a spider in real life, maybe you could hold a spider in virtual reality and kind of see yourself doing that. And maybe by seeing yourself doing that, it kind of helps you overcome that fear response. Okay, so we're going to look at sort of an early history of therapy, at least how we have historically treated those who are mentally ill. Unfortunately, for a large amount of human history, we isolated and kept those people physically removed from society in asylum-like conditions. It's not until maybe the last couple hundred years that we, literally took people who were mentally ill out of dungeon and asylum-like conditions and gave them what we might consider humane treatment, although that, even that word humane is a pretty recent add-on to how we've treated the mentally ill. If we even go as far as back as, in the 20th century and the use of mental hospitals, until we saw the advent of certain medications, many people were confined to mental hospitals for their entire lives if they're mentally ill. If you're schizophrenic or bipolar and suicidal or, dealing with some kind of severe disorder, you were contained to a mental hospital because there was just, as a society, we had no other way of treating these illnesses. But now we move forward to 2019, we move forward into the future, and we see more of a community mental health approach or movement where people are spending less and less time in inpatient settings, and they're spending more and more time at home, going to outpatient treatment, getting help in a non-sort of hospital setting. And that's been a huge growing trend over probably the last 20, 30, 40 years. You just don't see people stay in mental health facilities as long as they used to. And in fact, you just don't see as many state-run mental health facilities. A lot of that has to do with funding, for better or worse. We just don't see them around anymore. So it's undergone a lot of change. I mean, ideally, it's gotten better and better with time, but I would say it's a pretty slow progression, in my opinion. Here's a famous painting. It's called The Unchaining of the Patients of La Salpêtrière. I don't know, Patriere. I mean, I'm probably mispronouncing this. It's French, and I don't know French, so I apologize. But this is a famous image of people who were contained to these asylums being liberated. And I believe this is in France. And you can see, I mean, many of these people are literally chained. You can see here, this lady is chained. This lady here is too. And this is the first time many of these people are being liberated. Now, of course, fast forward to 2019, things don't look nearly this dramatic, but it's been a pretty slow change, at least in my opinion. Okay, truth or fiction. Residents of London used to visit the local insane asylum for a fun night out in the town. Oh boy, it sounds exciting. This must be before Netflix. Pause the video. What do you think? It's true. Unfortunately, it's true. That was a site of entertainment. Was, hey, let's go to the insane asylum and watch the people who are quote unquote crazy or insane. And it doesn't surprise me. As humans, we used to watch gladiator fights. We still watch pretty insane things now, so I can't say I'm surprised. But not a very bright spot in humanity, in my opinion. Okay, so the first type of psychotherapy we're going to talk about is psychoanalysis. Anytime we hear psychoanalysis, we got to think of Sigmund Freud. And the idea of this is to tap into the unconscious mind, find out why we have these repressed feelings and urges, according to Freud, this unconscious part of our mind that's kind of dying to get out, and it's sort of the root of all of our conflict as an individual. So in Freudian psychotherapy, Freud would encourage a person to engage in free association, where you just say whatever comes to mind. You'll lay on the couch and just talk about whatever comes to mind. And the idea is, if you just let things spill out of your mouth, eventually something truthful, something will come out, will seep out from the unconscious mind. Maybe you'll reveal something about some kind of inner motive about why you behave and think the way you do. Oftentimes this is not easy. This process is not easy. Freud, it takes a while for people to open up and express certain things. And because of this, they may, Freud would call this resistance. There are certain ideas that are too anxiety provoking or too threatening to your sense of well-being that you're kind of afraid to let out. It's also not uncommon in cases where because you spend so much time in this therapeutic setting, you have clients who are transferring feelings from one relationship onto their therapist. So maybe they come in and they're complaining about their wife or their boyfriend or their mom and dad, and all of a sudden they've complained and said so many things about this person enough times they start thinking about their therapist in the same way, and sort of a very Freudian idea. Dream analysis is another big part of this. I mean, Freud thought that, hey, our dreams are the window into our unconscious mind, and if we really want to understand how people think and behave and what their motives are behind, who they are as a person, then we need to look into the dreams. We need to see into that window of the unconscious. This is an example of what Freud's room would look like if you were a client. Freud would sit here in this green chair, maybe taking notes, smoking a cigar perhaps, and you would be lying here as the client. And anyways, so this is a lot of times what we think about with psychotherapy, this idea of laying on a couch and talking about our feelings. It's a very Freudian aesthetic to psychotherapy. Of course, now psychotherapy as far as psychodynamic or psychoanalytic therapy is still in use today, but it's far less intense than it used to be. Not nearly as much focused on sex. There's maybe, you're not laying down like you once were. You're sitting face to face. Oftentimes there is not so much focus even on the unconscious mind, like the id portion of our mind. So it's a lot different. A little more directive. The therapist telling you, hey, maybe, you should try this. Instead of trying to figure out what's in the unconscious mind, they're actually giving you suggestions about things that you might want to do to better yourself. Our next approach is called client-centered therapy. It is pioneered by Carl Rogers, among other folks. Carl Rogers is kind of the founder of this approach, and this is literally, it's called client-centered therapy for a reason. You're putting the client at the center of their own healing. They are the ones who are going to they are going to be the ones doing most of the work. The therapist is just there to sort of be a mirror and allow for insight to take place. So they're there to sort of allow and encourage self-exploration and self-expression through questions and asking for clarification and things like that. And some other characteristics that are common to this approach are unconditional positive regard, meaning, people come into therapy, having made mistakes in their lives, or feeling like they have, beating themselves up, maybe other people are beating them up too as well, not literally, but maybe, mentally. And the therapist's job is not to pile on. They're there to give positive regard to their client regardless of the things they say. A client may come into therapy and express things that are, oh my gosh, I got so mad and drunk the other day, I kicked my dog and I swore at my children or something like that. And, your first gut reaction would be to say, oh, this person is a jerk. They're swearing at their kids and kicking their dog. But the therapist's job isn't to judge. The therapist's job is to help this guy not do that again. And so, if the therapist is in judgment the whole time, then how are they going to help this person get any better? So also empathy and genuineness, keeping it 100 and being able to step in someone else's shoes and seeing things how they are. So those are important qualities. Those are important qualities for all therapists, but they kind of come from this sort of Rogerian client-centered therapy approach. Okay, truth or fiction. Some psychotherapists let their clients take the lead in psychotherapy. Truth or fiction? What do you think? Pause the video. Okay, welcome back. It is true. This is a very client-centered approach. Let the client do most of the talking, do most of the work. In this case, the psychotherapist kind of sits back and asks for clarification, asks questions to kind of keep the client talking, keep them moving, keep them thinking. Another approach is Gestalt therapy, which is pioneered by Fritz Perls. We don't really talk about him or the Gestalt approach too much, but the idea is this: it's really centered around this idea of self and this unified whole, and through when we are experiencing conflict in our life, we're kind of like fragmented, or where our self is sort of in fragments. We have these conflicting parts of our personality that are sort of butting heads, and the idea is to, through insight, through these discussions with a therapist, to unify the whole, to get all of these conflicting parts maybe in line with one another. And a big focus is on the here and now, what we can change now. Not so much about things in the past that we have no control over, or things in the future that haven't even happened yet. More on Gestalt therapy in this case. Your therapist is going to kind of lead their client through certain planned experiences. They're setting the table for they're creating an environment for the client to gain much better self-awareness of kind of what the conflicts that are going on, and also better ways to not only see what's going on, why they're behaving a certain way, but also ways to take responsibility. So it's a little Freudian in the sense that we're digging below the surface, but it's also, kind of a very modern approach to therapy. It's like, okay, we know what's going on now. Let's figure out how to take responsibility and change this. Now we're moving into more modern approaches to therapy, behavioral therapy. Pretty straightforward. The idea is to modify behavior. So, for example, someone who wants to quit smoking, someone who wants to quit swearing, someone who has an anger problem, who wants to stop lashing out, things like that. The idea is to use principles of operant and classical conditioning to change the behavior. So the idea is certain behaviors are learned, we can unlearn them or learn new behaviors instead. So this whole approach is to end self-defeating behaviors or behaviors that are maladaptive, and then to replace those with behaviors that are more adaptive and much more self-promoting rather than self-defeating. So again, this is a very behavioralist approach. B.F. Skinner, John B. Watson, people we've talked about before. We're talking about measurable behaviors. How can we watch them change and decrease? That's the cool thing about behavior. It is something you can measure and observe. And so, like with smoking, for example, you can target that behavior and say, oh, we want to see you smoke, right now you smoke a pack a day. We want to see, a month from now you're smoking half a pack a day. And 2 months from now you're smoking like a cigarette a day or whatever. And then by 3 months you're completely, removed. We can literally track that progress through behavioral therapy. Okay. Comprehension check. Quick one before we move on. Which approach to psychotherapy focused on the ways in which early childhood relationships unconsciously affect current relationships? Go ahead and pause the video. What do you think? Come back when you have an answer. Okay, welcome back. Couple things that should have tipped you off that we are talking about psychodynamic or psychoanalytic therapy. The first one is early childhood relationships. Anything childhood oftentimes is a big giveaway about Freud, and then the word unconscious is also a giveaway about Freud. Those two things are like, they scream Sigmund Freud. That's the crux of all of Freudian therapy, is things that happen in childhood and things that are happening in the unconscious mind. Okay, truth or fiction. Some psychotherapists tell their clients exactly what to do. What do you think? Pause the video. Come back when you think you have an answer. Okay, welcome back. That is in fact true. This is all about behavioral therapy. If you're wanting someone to change their behavior, you not only tell them what not to do, but then you replace it with what to do. Hey, stop smoking cigarettes and replace it with mints or something else. Replace it with those candy sticks, cigarette-looking things, or replace it with some kind of thing to chew on or whatever. Behavioral therapy is also used to reduce fears. I think we've talked about this in chapter 5, so I don't want to spend a ton of time, on this point. But the idea is, if you can learn how to, you learn how to fear certain things through either observational learning or classical conditioning. We learn to fear certain stimuli. But the idea is, if we can learn it, we can also unlearn it. We can learn it through systematic desensitization, just being exposed to it so much that we get over it. We can watch other people kind of interact with the things that we're afraid of. Like if we watch somebody else hold a spider, maybe it'll make us a little bit less afraid. And then virtual therapy. Again, we saw this in a previous slide. Hey, if we watch, we can't touch a spider in real life or a snake in real life, but if I can touch a virtual snake or spider, maybe that'll slowly help me get over that fear. This was common for also treating people who were developing symptoms of PTSD following 9/11. There's some research you can read about in 13.2 of our chapter using virtual therapy. Pretty neat stuff how technology is being used, in my opinion. Okay, truth or fiction, lying in a reclining chair and fantasizing can be an effective way for confronting fears. What do you think, truth or fiction? It's true. It is in fact true. That's a way we can also imagine the things that we're afraid of instead of actually confronting them ourselves. Sometimes thinking about it is where we start. Oftentimes in that process of systematic desensitization, we start with just simply thinking about a stimuli rather than actually interacting with it because maybe we're just too afraid to start. Another really neat technique that's being used for helping people treat a wide variety of conditions is called eye movement desensitization and reprocessing. It's especially for using like stress disorders, like anxiety disorders, PTSD. It's kind of a new developing therapy technique. You should really Google it and check it out. Read about it in your textbook a little bit, but it's this idea is that, it's a really neat way of looking at how, rapidly moving the eyes, back and forth, thinking about certain stimuli, or thinking about, or trying to think about the traumatic events, what this is doing. For some reason, we're still not quite sure why or how this is effective, but for some reason it works. So obviously this is still in development or still being used on a, pretty small level, but I think it just goes to show you some of the new innovative things that are happening in psychotherapy. It's not just sitting in front of in a chair and talking to somebody anymore. It's, it's a little more radical than that in some cases. Another thing to do, as far as changing behaviors is aversive conditioning. If you want to eliminate bad habits, you pair an aversive condition with something that's unwanted. So for example, if, like cats, those who've ever had cats, or dog, if a cat goes up on the table or goes somewhere it's not supposed to, or does something it's not supposed to, you spray it with that water, you get the spray bottle, you spray the cat, you want it to stop doing that. So every time it jumps onto the table, you spray it. Jumps on the table, you spray it, and eventually the cat just stops jumping on the table. Maybe. Most times it takes a while to work, because cats are pretty smart. Anyways. But that's a way we can use behavioral therapy to modify behaviors. Same thing with smoking. There's certain things you could do. Hey, every time you see someone smoking a cigarette, you blow an air horn. I'm just kidding. Don't really do that, but that's just an example. Okay, truth or fiction, then we're going to stop here. Smoking cigarettes can be an effective method for helping people quit smoking cigarettes. This sounds really weird, but it's actually true. In fact, you can get people, hey, you want to stop smoking? Why don't you just chain smoke a bunch of cigarettes in a row and gross yourself out to the point where you no longer want to smoke cigarettes? Not going to work for everybody, but it has in the past worked for some people who are trying to quit smoking cigarettes. Just get them overexposed to the stimuli to the point where it becomes aversive. Okay, we're going to stop here. We're going to pick up on behavioral therapy with operant conditioning. So far, we've looked at classical conditioning. We will pick up on that in part 2. So stay tuned for next time. Thanks, class.